My name is Emma Bradley. I am currently a clinical laboratory scientist at a company called Viracor Eurofins. Um, yeah.
What does that mean, that your scientist job?
Okay. So as a clinical laboratory scientist, I work in a lab and I work with patient samples that we receive from like clinics, hospitals all over the country. And we right now are getting a lot of samples for COVID. So we're doing a lot of COVID testing. My position specifically works with transplant samples. So when someone gets like a kidney transplant, for example, they'll send us a blood sample and then we can determine whether their body is rejecting that transplant or not with the blood sample instead of them having to do a more invasive procedure in order to determine that. So it's pretty cool.
That is pretty cool. If you have questions, remember you put them in the chat. Otherwise, I'll ask questions until some of you come up. So you told me you're going to grad school. Tell me about what you're going to grad school for and why.
Yeah, I'm starting a grad program in genetic counseling, which is kind of going to be working with families or patients who find out that they have a diagnosis of a genetic disorder of some kind, and kind of helping them understand how to cope with that diagnosis and like what steps they're going to have to take in the future. Yeah.
What is a genetic diagnosis?
So there's a lot of different genetic disorders that someone could be diagnosed with. It could be something just as simple as like not being able to have kids very easily, or it could be something like a disorder that causes them to look differently from other people, or to have pain a lot of the time. And so a genetic counselor is going to work with those patients who have some sort of diagnosis in order to help them live their best life, basically.
Remember to put your questions in chat if you have any. What would you ever tell somebody not to have children based on their genetics? Well, can you tell us what genetics is and then answer that first question?
Tell you what genetics is?
Yeah, what is genetics for people that don't know what genetics is?
So genetics is basically just what your DNA tells us, I guess. So you get genes from your mom and your dad when you're born, and we can look at the information from those genes, and it tells us a lot about like who you are, kind of. What was the other question?
So your genes tell you who you are, and these people have genetic disorders, so their genes are a little bit different, and it maybe makes their life a little bit more difficult.
Yes.
So maybe my question was, would you ever tell someone not to have children?
I think it definitely could happen, just depending on what it was that the two parents had. It would definitely have to be like both parents have the same genetic mutation that was going to cause maybe their child not to be able to live very long or not have a very good quality of life. And so then I would definitely encourage them maybe consider other options like adoption or surrogacy.
What school did you go to?
I went to Bethel College, which is a small school in Kansas, where I'm from. It was related to my church, so that's kind of why I went there. And I also participated in the orchestra at the time, and they had a strong biology program, which is what I wanted to study.
Thank you for that question in the chat. Remember, if you have questions, you should ask them. So tell me have you ever made like a mistake at work, and what happened with that?
Yeah, it's not uncommon, especially in a lab, to make mistakes because it's just a lot of really precision work that we're doing. And like I've definitely made mistakes before, and when that happens, I'll just contact whoever my supervisor is and let them know. And generally we have enough of the patient samples that we receive that we can kind of rework things and it'll be okay. But definitely just being upfront with your supervisor or whoever when a mistake is made makes things a lot better.
So I'm hearing you say that it's okay to make mistakes when you're in science.
Definitely.
We got some more questions in chat. How many years did you go to school?
So far I did 4 years of college, and with the program I'm starting, I have 2 more.
What made you want to do genetic work?
So my first job out of college was working in a newborn screening laboratory, which is we get samples from every baby born in the state, and for those samples, we test for a whole panel of genetic conditions. So that was a job I just kind of fell into. I wasn't necessarily looking for genetic work, but once I started working there, I was really excited about it, and seeing all the genetic disorders that we tested for and how the genetic counselors on staff there worked with the patients, I got excited about it and decided that was kind of what I wanted to pursue.
Somebody wants to know what genetic condition you encounter most often.
So at my current job, I don't encounter as many genetic conditions because I'm working with transplants right now. But at the previous job where I worked with newborn screening, some of our most common genetic conditions were like sickle cell anemia. Yeah, that was the most common one.
So some people remember that you can be asking your questions in chat. Otherwise, I'll be asking my questions, which I think are interesting. What advice would you have for my students?
I think definitely in middle school, like science can seem kind of hard and scary, but I think it's definitely worth pursuing. And I think that your teacher definitely wants you to get excited about it. So it sounds like he's doing a lot of projects with you that are fun and interesting. And so I think just sticking with science, even if it seems a little bit scary sometimes, will definitely be worth it for you.
And great advice. I love that. How much money do you make? Or how much money would somebody in your field make?
Yeah, I currently make about $55,000 a year, but in my position, you can make probably up to 70 or 80,000. Once I finish my genetic counseling program, I'll probably make closer to 70,000 or 100,000 starting out, and that can definitely go up.
Remember that I have a master's degree and 6 years of experience, and I make less than she does. And how many years of experience do you have?
3.5.
So I have twice as much experience, a master's degree, and I make less money than she does. So just remember that. Somebody wants to know how old you are.
I am 26. I can't hear you.
What do you wish you would have known when you were in like junior high science?
I guess personally, I kind of wish I would have known that that was what I was going to choose to go into. I mean, I think I definitely was interested in it and excited about it at the time, but like maybe I could have been more excited about it when I was there, because at the time I thought I was going to study math, which didn't pan out.
Okay. We'll give you another hard question. How has being Black affected your career?
I mean, in some ways, it's definitely good, which I feel like is not what you hear all the time, but it just lets me view things from a different point of view than a lot of my other coworkers, because I think that my position currently is definitely primarily white. So I can kind of, yeah, like I said, bring in a different point of view than a lot of my white coworkers. But at the same time, it can sometimes be hard if especially all your supervisors are white or not people of color at all, that it's just harder to relate to them. So it's sometimes harder to get like the promotions or the raises that you're looking for, and you've got to fight for it a little more than your white colleagues might have to.
We got a question from chat. What school should somebody go to? You've got somebody excited. They're like $100,000 a year. I'm in. What school should
Yes.
they go to if they want to study to do genetic work?
Well, it's a growing field, so there's a lot or lots of schools now that are getting programs in genetics. And like I'm doing genetic counseling, but there's also like tons of different jobs in genetics that you can go into. Um, but really any like school in like a state school or even private schools probably are still like gaining genetic programs.
We're not satisfied, but what school would you recommend?
That's a good question. Well, the school I'm going to go to for my grad program is called Bay Path University, so I guess I would recommend that. It's in Massachusetts, and I'm doing my program fully online, so I've never even been there, but it's a great school.
And so, what do you think about online learning? Because we're learning online.
Yeah. Well, I haven't actually started yet, but I'm excited about it. I think it's going to be a great opportunity for me because I can continue working and I can live wherever I want for my program. I think that's what's really nice about college level programs that are online is that you can be anywhere and you can attend a school anywhere. So if there's a program that you want somewhere that isn't near you and it's not feasible for you to move there, you can do it online, which I think is a great opportunity.
What's a normal day look like for you?
So for me currently, I arrive at the lab in the morning and we have sort of a meeting with everyone on my team and we talk about any problems that we've had and what we're going to need to tackle that day. And then generally what I go do after that is I'm working on some genotyping. So I'll take patient samples that are from their white blood cells and I will extract the DNA from that. And then I'll go through a whole procedure that basically ends with me putting on this big fancy instrument that's going to tell me all of the different components of their DNA. And it's exciting. I never thought I would be doing something like that, but I like it a lot.
How expensive is the equipment that you work on?
Very expensive. I think the instrument that I use most often is probably around $200,000. That's a pretty consistent cost for a lot of the instrumentation that we have in our lab, but there's anything ranging from like $10,000 to like probably about $1 million for an instrument.
We got another question from a student who's asked several questions today. She might earn some extra credit points for her participation. Remember that if you have questions, you can put them in chat. If you wanted to be something else than genetic, is it a genetic engineer?
Genetic counselor.
If you wanted to be something other than a genetic counselor, what would it be?
For a long time, I thought I wanted to be a doctor. So I think that if I weren't doing genetic counseling, I would maybe still pursue that. I think that if I were a doctor, I would want to do something like radiology, which is like working with x-rays and different types of imaging to kind of look at the inside of people's bodies without, of course, actually looking inside of their bodies.
Have you been a teacher before?
I have not. Teaching scares me a little.
So can you tell me about how like DNA, and then I guess the question would be, how different would my DNA be from your DNA?
So for the most part, our DNA would be very similar. Of course, there's going to be differences because you're a man and I'm a woman. That's one big difference that happens in DNA, but there's also a lot of kind of wiggle room in there. But yeah, for the most part, our DNA is going to be very, very similar. There's millions of bases in our DNA, and so millions of those are going to be identical, but then there will be small differences and mutations throughout that's going to make us different.
And does DNA have anything to do with the fact that, like, I'm white man and you're a black woman?
Not really.
Not really. So, can you help explain that?
No.
All right, that's all right. Because maybe it's a social construct would be what you'd get at a little bit. Is that all right?
Yes.
Okay.
Yes.
And they are social constructs. They are. Would it be biologically male? Is that better language?
Yeah, I think so.
Okay, so would it have anything to do with the fact that I'm biologically male?
What have anything to do with that? Sorry.
DNA.
Yes.
Okay. Remember to put your questions in chat if you have any. Wisdom wants to know, what do you like about your job?
I really like working with a lot of other people who are as excited about science as I am. And I like that since I work in a clinical lab, I'm actively helping patients every day. So people who need to know something about what's going on inside their body, we're able to help them determine that with our testing. And so we really get to help people a lot.
Um, so far, is there anything that you would like to add to that you think people should know about your job?
Just that it's awesome.
We have a great question from somebody who's anonymous in our chat, but is your job more generally have more women in it or more men in it?
I think we have probably about 60% women, 40% men at my job. But there are a lot of men in leadership positions currently.
Do you want a leadership position someday?
Yeah, I'm actually currently, I applied for one and I interviewed last week. So hopefully I'll get to be, it's called a clinical laboratory scientist coordinator. So that's just kind of helping my team organize a little bit better.
Somebody else wants to know, do you work by yourself or do you work with other people?
So in my lab, we have about 20 people, I think. So technically we work as a team, but a lot of my personal workload is I'll like just go kind of in a room by myself and do a lot of work. So definitely as a lab scientist, you can kind of work with a lot of people or you can work by yourself depending on what you prefer.
I need some more questions in the chat. So if you're curious about something, let me know. How has coronavirus affected your work? Great question.
So since I work in a clinical lab, our lab has started doing a ton of coronavirus testing, and especially since we bring in samples from across the country, not just locally, we're doing lots of coronavirus testing. So that's definitely kind of changed the lab because we had to prepare for that really quickly and get that testing up and running. But in terms of effects for me more personally, we have to wear masks at work. For a while, we had to wear masks and face shields, and it's just kind of, social distancing. Like we can't get too close to people. But other than that, it's not a huge effect. There's some people who got sent home and have to work from home if they're not working in the wet lab. But for me personally, I still go to work every day like normal.
Where do you live? People are confused.
I live in Kansas City.
And are you scared of working during the pandemic?
I'm not, especially at my job. I know that all of us are scientists and we know how to be safe during this time. So I feel really comfortable going to my job every day.
When you say you do coronavirus testing, what do you actually do?
So we receive those those nasal swabs that everybody talks about that are horrible. And we take those and we extract the RNA from the coronavirus. And then
What's RNA?
RNA is basically just DNA, but a little bit different. It's, RNA is going to be in a virus. A virus doesn't have DNA, but it does have RNA. But so we extract the RNA from that virus, or if the virus is present, obviously. And so then we're testing to see if it is present, if it's that specific viral RNA. So we can determine if a person does have the coronavirus or not.
How long do those results take to get back?
Ideally, our test takes about 12 hours from when we receive a sample, but it can be up to probably 4 or 5 days, depending on how many we have.
And something that's interesting to me is, do you have any genetic diversity within the coronavirus samples that you get? Which is scary if you do, right?
Yes, I think we have a little bit, but our current test doesn't really test for that necessarily. So if something or a sample were too different, our test wouldn't catch it.
Remember to be putting your questions in chat if you have any. So we've covered the basics.
Sorry.
It's okay. There, that's better. The lighting got lots better. We've covered the basics. We have about 13 minutes left. People can ask any questions they want. In the time, in your 3.5 years, how have you grown as a scientist?
Yeah. Well, so in a lab job especially, there's a lot of different types of science that you're going to be working with. So in my current position, we have about, I would say, 8 different tests that we do, and they're all pretty different. I work in a sequencing laboratory, so in all of them, we're working with kind of genetics and DNA, but there's a lot of different just methods and types of science that we're using to complete that testing. So it takes a while to learn each one, but I get to learn how to apply different types of science to it, get my end results or whatever. And in my last job, we also had about 10 different tests. So during the 3-ish years that I was there, I got to learn how to use a lot of different types of science too.
When do you get most excited at work? Do you ever get really excited about something sciencey?
Yeah, I actually got really excited yesterday because I help with some analysis for a test for HIV drug resistance, and we got a really strange mutation that none of us had ever seen before. So it's kind of exciting when you find something new, and hopefully we're able to use that information that we find to help a patient.
And so you do coronavirus testing, you do HIV testing. What other kinds of testing do you do? And is it different, like when you test for HIV, is that different than when you test for coronavirus? And if so, how?
Mm-hmm. So the beginning stages are really similar. We're always going to start with extracting the DNA or the RNA from a sample to either determine that the virus is there, or determine with the HIV, what we're looking for is what kind of medications we can use to help those patients. So with the HIV, it's going to be like, how has this virus mutated so different drugs will not work to treat it? And so with the coronavirus, it's different because we're just literally looking to see, does this person have coronavirus right now? And then we also do, like I said, transplant testing. So that is kind of a completely different thing. What I'm doing is I'm looking at a patient's full genotype and then comparing that to the DNA of the donor of the transplant. And then we're just going to look at that and see, okay, well, if there's too much donor DNA present, that means that the transplant is rejecting. So that's kind of a completely different workflow than the ones where we're looking at viruses, but most of the viral assays are really similar.
Cool. Would you know, like we're trying to interview one Black scientist a week. So would you know other
Mhm.
Black scientists that would want to talk to us, or in STEM generally, science, technology, engineering, or math?
Yeah, I would probably have to look through my friends list, but I could definitely send you some people.
Now, remember that if you have questions, you're going to put them in chat. I don't know if I have a ton more questions personally. It's a lot of pressure to come up with all the questions, y'all. I will give you 1 extra credit point per question you've asked in this chat if you have your name with it. So some of you are anonymous, so you'll have to write your name into the question as well. I've asked all of the ones here. Let me think. So, what do you do besides science? What do you do besides your job?
Which is outside of work.
Right.
Well, I have a dog, and he's adorable and awesome, so I spend most of my free time with my dog. Um, yep, that's mostly what I do.
What is the most like? People already asked you what you would do to do the someone already asked you what you would do for if you were not a doctor, um, or if you would be a doctor if you were not a scientist. What would you do?
Yeah,
Do you think that you'll be a scientist for the rest of your life?
that's the plan. Especially once I'm working as a genetic counselor, that's hopefully what I'm going to do for the rest of my life. I definitely think like there are other things that could be kind of fun to do. Like one of my silly little dreams is to own a coffee shop someday, but that'll be like my side hustle. So, multiple streams of income, always good to have.
Um, and when you're doing your testing, the independent variable and the dependent variable. So the independent variable is what you change. So in your case, that would be the lab samples. What would the dependent variable, or like would the results be the dependent variable?
I think so.
Yeah, I think so, because that would be what changes based on your.
Yeah.
That would be it. Do you collect your data in any way? So do you keep track of how many coronaviruses you're getting per thing?
Yeah. That's not like, I don't do that personally, but our um, coronavirus team sends out an email to everyone periodically saying, like, this is our positivity rate. So this is how many of our coronavirus samples have come back positive out of the total amount of samples we've gotten. And we can kind of look at information about like where most of our positive samples came from compared to how many samples we got from each of those locations. So we definitely do kind of collect our data and use it to look for trends that we find.
How hard is your job?
It's definitely difficult when you're starting out learning a new test. Like there's just a lot of new things to learn, but it's not like hard at all. I think anyone can do it if they've taken the time to try to learn how to work in a lab and they are willing to follow instructions and work with the team.
I have a student that wants to know, how long are you going to pursue your dream?
Well, hopefully I only have to pursue it for 2 more years and then I'll be doing it. But I definitely am going to stick with it until I end up in the career that I want to be in. And then hopefully we'll stick with that long term afterwards.
And then I have another student that wants to know, how many hours do you have to work a week?
Yeah. So I'm scheduled to work 40 hours a week, which is 8 hours a day, but I'll often stay an hour or two extra from like any given day, just because I want to make sure that we're getting our patients their results as quickly and accurately as we can.
And you're salaried, so you don't get paid extra for staying overtime, or you do?
I'm hourly.
Okay, so when Mr. Hofkamp works more hours, he does not get paid for more hours. So not only do you make more money, you get paid for all of the work that you do, which is great.
Yeah,
Which is
definitely
why
an hourly job that pays overtime, because overtime is time and a half.
and if we notice a theme here that also happened with our Boeing engineer that we talked to, is he got paid for overtime as well. Who all works with who all would touch a coronavirus sample from the time that you give it to the time that you take it? Somebody wants to know, like, who all works with it.
So when you're first getting a coronavirus sample taken, it'll just be a nurse or someone at a clinic who's going to take your sample, and then they'll send it through kind of their shipping department at work. So that's a lot of different people at that original clinic who's going to see it, and then it'll get sent to a lab. So it's not just lab scientists who work with genetics who are going to work with that, but just kind of any lab scientist. Lots of different types of labs are starting to work on coronavirus testing. So definitely not just people in genetics, but anyone who wants to work in a clinical lab could work with coronavirus samples. And then, of course, there's going to be the people who do the resulting on that sample, and then they'll send it back to your doctor.
I didn't ask that question correctly. Thank you for letting me know. So how do only genetic workers work with coronavirus samples?
So not really, just any kind of clinical lab scientist could work with it, whether they're specifically working with genetics or whether they're working with just kind of more general clinical samples.
We have 3 minutes left, so if you have a burning question, this is the time to ask it. I hope that I got your question right the second time. People that join later asking about how much money you make, and I'll let you tell them again. In a different way, how much money do you make per week?
I think it's about $1,000 per week. I guess a little more than that. After taxes, it's close to $1,000 per week.
It's hard not to be bitter that you make so much more money than I do, because you're younger than me and don't have a master's degree, but I'm going to get over it. I'm going to get over it.
You can come work in my lab.
I can do what?
You can come work in my lab.
I don't think I'm qualified to work in your lab. I do not have a biology college degree.
Oh. Well,